Plantar fasciitis and associated heel pain is one of the most frustrating issues we face in our physical therapy clinics. In this video, I'm going to show you some simple, effective ways to reduce your pain and give you a few things to do so it doesn't keep coming back. Fasciitis contains the root word itis, meaning inflammation. Many cases of foot and heel pain involving the plantar fascia aren't really inflamed. They are just painful. If you've been on the internet trying to learn from the experts, you may have heard the more technically correct term to use is plantar fasciopathy. It really doesn't matter what term you use. We're all talking about the same thing, tomato, tomato, right? I could go into detail about the condition of plantar fasciitis, but today's video is all about simple ways to treat your pain. Fortunately for you, we have another video that takes a deeper dive into this condition. By the way, if you haven't already, please hit the subscribe button below. It really helps our channel grow and allows us to keep putting out this free content every week. In most cases, plantar fasciitis does not just come out of nowhere. It's usually linked to an increase in activity or even wearing a new pair of shoes. Make sure you take a second to think about this. Making a couple small changes can make a big difference over time. Let's start with footwear. There's some pretty good research that supports changing footwear often and wearing shoes with supportive insoles to help decrease foot and heel pain. They might not get rid of the plantar fasciitis, but they could help decrease your pain. Now, there are some people who will try and pitch you on expensive insoles. These companies that make the expensive insoles even pay for some of this research that supports them. Is that a red flag? I personally have not been able to find any strong correlation between effectiveness and cost of insoles. Sometimes the cheap ones are just fine. Keep in mind that they should work pretty quickly. If you have insoles that aren't providing you relief after a day or two, or even making your pain worse, stop wearing them. One of the hallmark signs of plantar fasciitis is first step pain. This is exactly like it sounds. It feels like someone is driving a nail into your foot when you take that first step out of bed in the morning or after sitting for an extended period of time. Using a simple massage tool can help desensitize the nerves in the area and make the discomfort more manageable. You may have seen special tools with little spikes on them or been told to use a frozen water bottle. Even a wooden rolling pin placed on the carpet or on a towel will do the trick. Dealer's choice on this one. Both insoles and massage may offer quick but temporary solutions to your problem. These next 3 exercises will address the underlying issues and help to prevent your problems from coming back down the road. The first exercise is called arch cupping. We want to work the small muscles in the foot and ankle that help support the arch. Pain has a way of messing things up, and we want to show these muscles that they have a job to do. So let's zoom in and explain. In a seated position, think about moving this bone towards this bone in your heel as you cup the arch. Try and keep your toes on the ground. When you do this, you will feel your arch lift or cup. Do this a few times to get the hang of it, holding for 2 to 3 seconds and releasing slowly. Once you get the hang of it, try and do it without curling your toes, which will help focus on using the correct muscles. Repeat this 15 times and do 2 sets. This exercise can be progressed by doing it in standing, which will make things a little harder as your body weight tries to flatten your arch. Stretching your calf muscles is the key to reducing the load and strain on your fascia. The 2 main muscles in your calf are the gastrocnemius or gastroc and the soleus. And you don't need to remember the names, but you do need to understand how to stretch them both. We're going to use wheel chocks for the first stretch on the gastroc. You're going to put your toes up about halfway up to start, stand up nice and tall with your knees straight, and when you feel a nice strong stretch in the back of your calves, you want to hold that for 30 seconds. Repeat this 3 sets. By the way, you can pick these wheel chocks up off Amazon. They're pretty cheap, I think around 12 bucks. I'm going to put a link below in the description. And if not, you can just use a small step at home and stretch that way. For the soleus stretch, because the soleus muscle doesn't cross the knee, the only difference between the gastroc stretch and the soleus stretch is that we're going to bend the knees a little bit. So go back up on the wheel chocks and bend those knees a little bit. What it's going to do is take the gastroc muscle off stretch and put it on slack, allowing you to get a nice stretch in the soleus. If you don't feel comfortable doing both feet at the same time, bending your knees, you can do it one at a time and then alternate feet. Again, hold it for 30 seconds, repeat it 3 sets. These few things will get you started. Let us know in the comments if you have any questions, and don't forget to like this video and subscribe to our channel. Till next time.